One of the problems we have is that as people get older, they develop age-related degenerative changes in their spine. So if we do a scan and look at anybody's spine, we can see potential problems and potential pain generators. So what's crucial is that we're able to attribute a patient's symptoms with something that we see on a scan. And there's three parts to that. The first part is taking a good clinical history to understand where the pain is exactly, and try to work out where that may be arising from in the spine. The second thing is clinical examination to find some objective signs that would support your hypothesis. And then the final thing is to look at the structural imaging. And in spinal surgery, that's normally an MRI scan. And we put those three things together to try to come up with the most likely diagnosis. The first question I always ask myself is whether I can identify a reliable surgical target that I can address, which will improve a patient's symptoms. So I have to be fairly certain that we're on the right track and what we intend to do is going to help the patient. The second thing is to then work out whether it's necessary. And for surgery to be necessary, it has to pass two tests in my book. The first test is that surgery has to be better than the natural history. What I mean by that is that surgery is better than doing nothing for that patient. The second test is whether the benefits of surgery outweigh the risks. Obviously, if they're very, very high risk and very low benefit, then surgery may not be correct for that patient. Well, the first thing that I think is very important is that the patient understands all of the treatment options available. So in clinic, I will take them through every one in turn. It may be that some of those options are not very, very favourable options, but it's important that they understand all the options open to them. I think to aid the understanding, I sometimes use diagrams, I sometimes use 3D models in clinic. And I also signpost patients to other websites and other sources of information so they can get a more rounded picture of all of those options. The final thing, which I think is very important, is that patients are given time to absorb all of that information and come to the right decision for themselves. So very often I will send patients away with homework to look into all of these different options, and then we schedule a follow-up appointment to make a definitive decision. So I think there are patient-related factors, and then there are also technical-related factors related to the surgery. But if we start with the patient-related factors, as I said previously, any intervention comes with benefits and risks, and it's very, very important that we tailor those benefits and risks to an individual patient. And that means really understanding what it is that a patient wants to get out of any treatment, what their hopes and ambitions are for the next 5-10 years, what their attitude to risk is now and in the future. And that varies for everybody, and that's why it has to be a very individual decision. Equally, there are technical aspects and technical benefits and technical risks with different treatment options. And as a guiding rule for me in spinal surgery is that we should do as much as is necessary, but as little as is possible. And that means that I will probably always recommend a minimally invasive or less invasive approach if I feel that has a good chance of getting a good outcome. A good question. So as I alluded to earlier, in my practice, I tend to present a patient with a range of treatment options, and that's really based on what they've told me, what their preferences are. It's also based on the evidence and my own knowledge of long-term outcomes. Sometimes it's a very clear recommendation because it's clearly one treatment which is favourable. Sometimes the situation is less clear cut, and in those situations, I would never push a patient one way or another. The patient is the boss. They know their situation much better than anybody else, and I will listen and be guided by them.